Look at your fingernails right now. Go ahead, hold your hand up and take a good, honest look. Do you see ridges running from top to bottom? Are any of your nails turning yellow, getting thicker, or pulling away from the nail bed? Is there a dark line or stripe underneath one of them that you have been ignoring for months? If you nodded to even one of those, I need you to stay with me for this entire video, because what I'm about to tell you could change everything. Your nails are not just decoration. They're not just something you trim once a week and forget about. Your nails are a window, a real visible window into what is happening deep inside your body right now. And after 60, what they reveal becomes far more urgent. Most people walk past a mirror, glance at their hands, notice something odd about a nail, and think it is just aging. They shrug it off. They paint over it. They ignore it for years. And in some cases, by the time they finally mention it to a doctor, the hidden condition behind that nail change has been progressing quietly for a very long time. That is what this video is about. Not to scare you, but to open your eyes to something your body has been trying to tell you, possibly for months or even years, through something as simple as the tips of your fingers. I am Dr. Edward Wright, and for years I have focused on helping older adults understand the signals their bodies send before things become serious. I believe that knowledge protects independence. I believe that the people who age the strongest are not necessarily the luckiest, they are the most informed. And I created this channel so that clear, honest health information reaches the people who need it most. You, your parents, your spouse, your friends. Today I am going to walk you through the nail changes that doctors pay close attention to. We are going to cover 8 warning signs your nails can show you. 8 changes that could point to problems with your heart, your lungs, your liver, your kidneys, your thyroid, your blood, and even the risk of something far more serious. For each one, I will explain what it looks like, what it could mean inside your body, why it matters more after 60, and what you should actually do about it. And I want to be upfront with you at the last one on this list. Number 1 is the one I most urgently want you to know about. It is the one that gets overlooked the most, and it is the one where early awareness can truly make a difference. So stay with me all the way through. Before we begin, I want to hear from you. Take a look at your nails and tell me what you see. Comment your age below and describe any changes you have noticed. Ridges, color changes, thickness, brittleness, anything. Your comment may help another senior watching this video recognize something they have been ignoring. Now, let us begin. Number 8, brittle, dry nails that crack and split easily. This is probably the most common nail complaint I hear from older adults. Nails that chip at the edges, nails that peel in layers, nails that seem paper thin and break just from opening a can or scratching a surface lightly. And almost everyone dismisses it. My nails are just weak now because I am getting older. And yes, it is true that nails can become more fragile with age. But here's the part most people miss. Persistent brittle nails, especially if they have worsened noticeably in the past year or two, can point to a thyroid problem. Your thyroid is a small gland in your neck, and it controls your metabolism, the speed at which your body runs. When it slows down, a condition called hypothyroidism, everything slows. Your energy drops, your skin dries out, your hair thins, and your nails become weak, ridged, and prone to splitting. After 60, thyroid issues become much more common, and they are also much easier to miss because the symptoms overlap with what people assume is simply aging. Think of it this way, your nail is like a tiny building being constructed from the inside out. If the supply chain of nutrients and hormones running that construction slows down, the building comes out fragile, not because the materials are bad, but because the process lost its rhythm. I once spoke with a woman in her late 60s who told me she had been dealing with splitting nails for over 2 years. She had tried every nail cream and supplement she could find. Nothing worked. It was not until her doctor ran a simple blood panel for something else entirely that her thyroid levels came back low. Within a few months of treatment, not only did her energy return, her nails started growing in stronger. So, if your nails are persistently brittle and you're also feeling unusually tired, cold, sluggish, or if your skin is drier than usual, ask your doctor to check your thyroid levels. It is a simple blood test, and it could explain much more than just your nails. Now, the next one is one that a lot of people notice but rarely talk about. Number 7. Vertical ridges running from the base to the tip. If you hold your nail up to the light and see fine lines running lengthwise, like tiny grooves pressed into the surface, you are not alone. A very large number of seniors have them. And I want to be honest, in many cases, mild vertical ridges are indeed a normal part of aging. They are similar to wrinkles on the skin. As you get older, the nail matrix, the part under your cuticle that produces the nail, becomes slightly less even in how it works. But here's where I want you to pay closer attention. If those ridges are deep, if they appeared suddenly, or if they are accompanied by nails that have become very rough or fragile, this can sometimes point to nutritional deficiencies, particularly iron, zinc, or B vitamins. After 60, your body absorbs nutrients less efficiently. Your stomach produces less acid. Certain medications, especially acid reflux drugs that many seniors take daily, can reduce absorption even further. So even if you are eating reasonably well, your body may not be getting what it needs to build healthy nail tissue. Imagine a factory running low on raw material. The product still comes off the line, but the finish is rougher. The quality drops. That is what deep ridges often reflect. Your body doing its best with less. A man I spoke with, a retired teacher in his early 70s, had always had smooth nails his entire life. Over about 18 months, deep grooves appeared across several fingers. His doctor found he was significantly low in iron, even though he was eating meat regularly. The issue was not his diet, it was absorption. If you notice deepening ridges, especially paired with fatigue, pale skin, or a sore tongue, ask your doctor to check your iron levels, your B12, and your zinc. These are straightforward tests, and correcting a deficiency can improve not just your nails, but your energy, your thinking, and your overall sense of well-being. This matters more after 60 because these deficiencies tend to worsen slowly and silently, and they mimic normal aging so closely that most people never investigate. And speaking of things that creep in quietly, this next one catches many people off guard. Number 6. Yellow nails. Now, yellow nails can absolutely be caused by something as simple as years of nail polish use. If that is the case, it is cosmetic and it is not a concern. But if your nails have turned yellow and you do not use polish regularly, or if the yellowing is getting thicker, more opaque, and harder to ignore, then your body may be signaling something deeper. Persistent yellow nails, especially if they have become thickened or growing more slowly than usual, can be associated with lung conditions, lymphatic drainage problems, or in rarer cases, a condition that doctors sometimes call yellow nail syndrome. In this syndrome, nails grow very slowly, become yellowish-green, and may curve excessively. It is sometimes linked to respiratory problems such as chronic bronchitis, recurrent infections in the lungs, or fluid retention in the legs. The connection between nails and the lungs may sound strange, but it makes more sense than you might think. Your nails need oxygen-rich blood to grow properly. If your lungs are not working at full capacity, the oxygen supply to those tiny nail beds drops. The result is sluggish growth and discoloration. Think of it like watering a garden through a hose with a kink in it. The plants at the very end of the line, the nails, are the first to suffer when the flow is reduced. Of course, the most common cause of yellow thickened nails in older adults is actually fungal infection. And while a fungal nail infection is not dangerous in the way a lung condition is, it should still be treated, particularly for seniors with diabetes, because the damaged nail can become an entry point for bacteria and more serious infections. So, if your nails have been turning yellow, please do not simply assume it is nothing. If it is fungal, it can be treated. If it is related to something else, catching it early protects you. Either way, mention it to your doctor. Let them take a look and decide. Now, the next one is something I wish more people understood. Number 5. Spoon-shaped nails that curve inward. This one is very distinctive. Instead of having a normal gently curved nail, the nail scoops inward like a tiny spoon. If you placed a drop of water on the nail, it would hold it rather than let it roll off. The medical term for this is conychia. In older adults, this change is most commonly linked to iron deficiency anemia. When your body is severely low on iron over a long period of time, the nail tissue does not form properly and it begins to thin and scoop. It is the body's way of telling you that something essential is running dangerously low. Now, iron deficiency in seniors can happen for many reasons. Poor dietary intake is one, but it can also come from slow chronic blood loss, from an ulcer in the stomach, from a condition in the intestines, or from something that needs medical evaluation. That is why spooned nails in a senior should never be brushed off as cosmetic. They can be the first visible clue to a problem that is otherwise silent. I remember reading about a case where a gentleman in his early 70s visited his doctor for unrelated knee pain. The doctor noticed his nails curving inward during the examination and ordered blood work. He turned out to have significant iron deficiency from a slow gastrointestinal bleed that he had not even noticed. Early detection of that bleed likely saved him from a much more serious outcome. If your nails are beginning to scoop inward, please do not wait. Have your iron levels checked, and if they are low, your doctor will want to know why. Because finding the cause matters just as much as correcting the number. Let us move forward because the next sign is one that affects how your fingertips actually look. Number 4. Clubbing of the nails and fingertips. This is when the tips of your fingers seem to swell or round out and the nails begin to curve downward over the fingertip, almost wrapping around it. The angle between the nail and the cuticle area changes. It becomes wider, puffier. Doctors call this digital clubbing. I want you to understand this clearly because this one carries weight. Clubbing is often a sign that your body has been low on oxygen for a significant period of time. It does not happen overnight. It develops gradually over months or years, and it is most commonly linked to chronic lung conditions, certain heart problems, and in some cases, inflammatory bowel disease or liver cirrhosis. Now, this is not something to panic about, but it is absolutely something to take seriously. If you or someone close to you notices that the fingertips have become rounder, that the nails have started curving over the edges of the fingers in a way they did not used to, this warrants a medical visit. Not next month soon. The reason clubbing happens is not fully understood, but many doctors believe it relates to how the body responds to chronic low oxygen. Blood flow to the fingertips increases, tissue swells, and the nail bed changes shape. Imagine a tree that has been bending in wind for years. Eventually, the trunk grows in that direction permanently. That is what clubbing is. The body reshaping itself in response to a long-standing internal signal. If you notice this, your doctor may want to check your lung function, your oxygen levels, and your heart. These are all things that can be managed more effectively the earlier they are caught. And before I share the next one, I want to pause and say this. If what you have learned so far has been helpful, take 1 second to press the like button. It is a small action, but it helps this video reach more seniors who might need this information today. And if you are not yet subscribed to Dr. Edward Wright, now is a good time. I put out clear, practical health guidance for people over 60. No nonsense, no gimmicks, just honest information you can use. Now, let us continue because the next 3 are the ones I want you to pay especially close attention to. Number 3, pitting on the surface of the nails. This one looks like someone took a pen and pressed tiny dents or shallow holes into the surface of your nail. Sometimes there are just a few. Sometimes the entire nail is covered with them. It can affect one nail or several. Nail pitting is one of the most closely linked nail changes to a specific condition, and that condition is psoriasis. Many people associate psoriasis only with skin patches, those red scaly areas that show up on the elbows, knees, or scalp. But psoriasis is actually a systemic condition that affects the immune system. And in many cases, the nails show signs before the skin does. Even more importantly, nail pitting in seniors can also be a clue to psoriatic arthritis, a form of inflammatory arthritis that causes joint pain, stiffness, and swelling. Many seniors with psoriatic arthritis are misdiagnosed for years because their joint symptoms are blamed on osteoarthritis or general aging. The pitted nails can be the clue that points the doctor in the right direction. Think about it this way. The surface of your nail is formed layer by layer like pages in a book. When the immune system causes inflammation at the root where the nail is made, some of those layers form improperly. The result is tiny craters, pits in the finished surface. I have heard stories of people who were treated for regular arthritis for years with limited improvement. When a new doctor noticed pitting on their nails and connected the dots, the diagnosis was changed to psoriatic arthritis. The treatment was adjusted and their joint pain improved significantly. If you notice pitting on your nails, especially if you also have joint stiffness, swelling in your fingers or toes, or patches of dry, flaky skin anywhere on your body, bring it up with your doctor. Ask them specifically about psoriatic arthritis. That one question could change the direction of your care. Now this next one is quiet. It does not cause pain. It does not look dramatic, but it tells a story that is deeply important. Number 2, pale or white nail beds. Normally, when you press on your nail and release, the pink color should return quickly. That pink comes from healthy blood flowing through the tiny vessels beneath the nail. But if your nail beds look chronically pale, washed out, or almost white, especially across multiple fingers, your body may be telling you something about your blood, your liver, or your heart. Very pale nail beds are commonly seen in anemia, a condition where your blood does not carry enough healthy red blood cells. In seniors, anemia is remarkably common and often overlooked. It causes fatigue, weakness, dizziness, shortness of breath, and a general feeling of fading energy that people attribute to age rather than to something treatable. But pale nail beds can also point to other concerns. In some cases, they are associated with early signs of liver issues, poor circulation, or even congestive heart failure, where the heart is not pumping blood effectively to the extremities. Think of your nail bed as a tiny window into your bloodstream. When the blood behind that window is rich and healthy, the view is pink and warm. When something is wrong, fewer red blood cells, reduced flow, lower oxygen, the view turns pale. A woman in her mid-70s once mentioned during a routine visit that she felt fine but noticed her nails had looked washed out for several months. Her doctor took it seriously, ran blood work, and found that she was significantly anemic from a vitamin B12 deficiency, something very common in older adults, especially those on certain stomach medications. Once the deficiency was treated, not only did her nail color improve, but she said she felt 10 years younger. If your nail beds have been looking unusually pale, do not dismiss it. Mention it at your next appointment. A simple blood count can reveal a great deal, and if something shows up, treatment is often straightforward and makes a tremendous difference in how you feel every day. Now, the final point, number 1. This is the one I told you about at the beginning, the one that I need every single person watching this to understand. Number 1, a dark streak or line under the nail. If you have a dark brown or black line running lengthwise under one of your nails and it was not caused by an injury, no hammer blow, no door slam, no memory of how it got there, please listen carefully. In many cases, dark lines under the nails are completely benign. They are caused by increased melanin production in the nail matrix and are especially common in people with darker skin tones, where it is usually nothing to worry about. But, and this is the part I need you to hear, in some cases, a dark streak under the nail can be a sign of subungual melanoma. This is a rare but serious form of skin cancer that grows underneath the nail, and it is one of the most commonly missed types of melanoma. Because people do not think of cancer when they look at their fingernails. Here's why this matters so much after 60. Melanoma, when caught early, has a very high rate of successful treatment. But when it is missed, when someone assumes a dark line under their nail is just a bruise or an age spot, and they wait months or years to have it checked, the outcome can be very different. There are certain features that doctors pay attention to. A line that is wider than 3 millimeters, a line that is getting wider over time, a streak that varies in color with areas of dark brown, black, and lighter brown mixed together, changes to the skin around the nail near the cuticle. A nail that is cracking or breaking in that area. These are all signs that should prompt a visit to a dermatologist. I want to use an analogy that may help. Imagine a stripe of paint on a wall. If it has been there since the wall was built, it is part of the design. But if a new stripe appears, one that was not there before, one that grows wider, one that bleeds into the surrounding surface that is not part of the original plan. That is something to investigate. The most heartbreaking cases are the ones where someone noticed the line, showed it to a friend or family member, and was told not to worry about it. Months passed. The line widened. By the time they saw a specialist, the situation had become far more complex than it needed to be. So, here is what I am asking you to do. Look at your nails, all 10 fingers, all 10 toes if you can. If you see a dark line under any nail, especially one that is new, that you cannot explain with an injury or that seems to be changing, please make an appointment with a dermatologist. Not out of fear, out of respect for your own body, out of the understanding that catching something early is one of the greatest gifts you can give yourself and your family. This is not about panic. This is about paying attention, and you deserve to have someone tell you this clearly. Now let me bring all of this together for you. Your nails are not just keratin growing at the ends of your fingers. They are a living record of what is happening inside your body. Brittle nails may reflect a tired thyroid. Deep ridges could signal missing nutrients. Yellow or thickened nails might point to your lungs or persistent infection. Spoon-shaped nails may warn of iron running dangerously low. Clubbing tells you that oxygen levels need attention. Pitting connects to immune conditions that affect your joints. Pale nail beds speak to the health of your blood and your heart. And a dark streak demands that you take it seriously and get it seen. None of these things on their own are a diagnosis, but every single one of them is an invitation. An invitation from your own body asking you to pay closer attention. And that is the message I want you to carry with you after this video. After 60, your body often whispers before it screams. Your nails are one of those whispers, and the seniors who age the strongest are the ones who learn to listen. You are not helpless, and you are not too old to take action. A simple conversation with your doctor, bringing up what you have noticed about your nails, asking for a blood test, requesting a closer look. That conversation could be the beginning of catching something early, correcting something quietly, and protecting the independence and energy that matters so much to you. The goal is not just to live longer, the goal is to live stronger, to walk confidently, to open jars without wincing, to hold your grandchild's hand and feel the strength in your own fingers, to wake up in the morning and feel like your body is still on your side. That starts with awareness. And today, you took a powerful step by watching this video. I am proud of you for staying with me. I am proud of you for caring enough about your own health to spend this time learning. And I want you to know that this channel, Dr. Edward Wright, once exists for you. Every video is made for people who refuse to stop taking care of themselves. Now, before you go, I have one final request. Tell me in the comments which of these 8 nail signs have you noticed on your own hands. Share your age and what you have seen. Your experience might be the reason another viewer decides to check their own nails today. If there is one change from this video you want to try first, whether that is checking your nails more carefully, booking a blood test, asking your doctor about your thyroid, or scheduling a dermatology visit, write it below. Saying it out loud, even in a comment, makes it more real. And if you found this helpful, please share this video with someone you love. A spouse, a parent, a friend, a neighbor who lives alone and might not hear this information anywhere else. You never know whose life could be changed by something as simple as paying attention to their nails. Subscribe to Dr. Edward Wright if you have not already. Hit the bell so you never miss a new video, and I will see you in the next one, where we will continue to protect what matters most: your health, your strength, and your independence. Take care of yourself. You are worth it.